You might not have thought of this, but what about prokaryotic cells? Nucleus? Microtubules? What I just described should make your brain itch a little bit because it cannot happen in prokaryotic cells. Instead, bacteria and archaea divide their cells in a process called binary fission, which really just means breaking or fission into two cells, binary. It's a much simpler process than mitosis, with just one looping chromosome to replicate and allocate to the daughter cells. When you see a bolded statement like this on a slide, you might expect that it is a very important statement. Prokaryotic cells cannot undergo mitosis. So let's walk through this process in a common bacterium, Escherichia coli, also known as E. coli. A certain sequence of the nucleotides in the chromosome is called the origin of replication. The DNA replication enzymes start copying the DNA at this site. And then the two copies separate and migrate towards opposite ends of the cell. The DNA is still being copied at this point, so when DNA replication is complete, the cell can be divided. And now there are two bacterial cells. Much more straightforward than all of the steps of mitosis. A lot of things needed to change to go from binary fission to plant and animal mitosis. As you might suspect, few mitotic fossils have been found, if any. I don't know of any. But we can look at single-celled eukaryotes and find evidence that mitosis has evolved in some different ways that seem transitional between these extremes. Here are some examples of variants of mitosis that have been observed. In diatoms, like I mentioned in the chapter on photosynthesis, the microtubular scaffold forms inside the nucleus with no breakdown of the nuclear envelope. In another group of microalgae, the dinoflagellates, the microtubular scaffold forms through enlarged pores in the nuclear envelope. The majority of eukaryotes, though, have a fragmentation of the envelope, like we saw in plant and animal mitosis. Different cells in the body divide at different rates. You may already know that our skin is constantly regenerating itself with old, dead skin cells being sloughed off and replaced from the bottom up, while nerve cells are notorious for not dividing much, if at all, which makes treating neural injuries and diseases very difficult. Following this logic, there must be controls for telling cells when to divide and when not to divide. We know of some of these controls, but we are very much interested in learning more about them because one of the leading causes of death in our country is uncontrolled mitosis, known more commonly as cancer. What controls the cell cycle? There are many factors, and though it may seem odd, these factors are not found in the nucleus, but in the cytoplasm. A clever experiment demonstrated this by fusing cells at different stages of the cell cycle. What the researchers found was when they fused the cytoplasm of the two cells but left the nuclei intact, one in the S phase and the other in the G1 phase, the G1 nucleus started replicating its DNA. It just immediately entered S phase. A second experiment in a cell in mitotic phase fused with a G1 cell, the G1 nucleus went into mitosis even though the chromosomes weren't even replicated. Even though the nuclei were intact, something in the cytoplasm influenced the behavior of the pair of nuclei. We now know of at least 3 different internal signals that regulate the different stages of the cell cycle. There's a G1 checkpoint, a G2 checkpoint, and the M checkpoint. One cytoplasmic regulator of the cell cycle is the production of maturation promoting factor, or MPF. In order for a cell to pass the G2 checkpoint, there needs to be enough MPF present in the cytoplasm. MPF is made from two proteins called cyclins and cyclin-dependent kinases, or CDKs. The concentration of a CDK is constant within the cytoplasm of a cell. The cyclin that combines with the CDKs are not. The cyclins have to be resynthesized by the cell. Experimentation showed that cyclin concentration was strongly correlated with MPF activity. After mitosis, the concentration of cyclin crashed and there was no MPF activity. This cartoon shows our understanding of how cyclins function. Cyclin is degraded in the new cell just after mitosis, but the CDKs remain intact. So the cyclins are this purple shape, and the CDKs are this orange shape. As the cell ages and gets ready to undergo a new round of mitosis, more cyclin is produced, more purple shape. MPF is the combination of cyclin plus CDK. MPF equals cyclin plus CDK. The cyclin CDK signal that triggers the passing of the G2 checkpoint is just one way that cells know whether to divide or not. There are many signals that are within the cell or endogenous, meaning that is being produced from within, and there are other signals that come from outside the cell, exogenous signals, that can also entice a cell to divide. Growth factors are a type of exogenous factor that encourages cell division. One of these is called platelet-derived growth factor, or PDGF. Platelets are found in the blood and associated with clotting when you cut yourself. In addition to clotting, the platelets also produce this growth factor, which stimulates cells in the area to start dividing to replace the damaged cells. But we don't want them to keep dividing, we just want them to fill in the damaged cells. This happened because of a cell property called density-dependent inhibition. We can mimic this in vitro, or outside the body, by using some human cells. While human cells dividing too much is problematic, because that's cancer, human cells are also notoriously difficult to get to divide outside the body, which makes developing effective therapies in vitro very difficult. And in vivo, or in living tissue, experimentation is unethical. And here I'll make a very brief plug for a book that should be required reading for any aspiring biologist or medical professional. That book is The Immortal Life of Henrietta Lacks. For brevity's sake, I will tell you only this. Henrietta Lacks was a woman who presented with symptoms of cervical cancer. She was a patient who had her tumor biopsied, or some cells were sampled. These cancerous cells have done something no other human cells had done before or have done since. They continued to grow outside her body in culture. Decades after the cancer took her life, the cells from her tumor continued to divide and live on, and have been of incalculable value to medical research. However, Mrs. Lacks never received credit nor compensation for being the donor of these cells, thus raising some very important ethical questions. Anyway, back to PDGF. We can culture, for at least a few rounds of mitosis, some types of human cells. If we were to take some human connective tissue, like cartilage or tendon, for example, and cut it up into small pieces, we could then digest the extracellular matrix and make a suspension of the cells called fibroblasts. If we put those fibroblasts into culture vessels and treat them with either PDGF or no PDGF, we would observe that the cells treated with PDGF will undergo mitosis. However, they won't just continue dividing indefinitely, but rather they will continue growing until they are surrounded by neighboring cells and then stop. This is density dependence. In addition to density dependence, well-behaved cells also exhibit anchorage dependence, meaning they won't divide unless they are anchored or attached to other cells. Density and anchorage dependence are both important for ensuring that cells don't divide too much. Though in cancer cells, both of these types of regulation are typically absent. This illustration shows the process in action. In a culture flask, the cells don't divide unless they are in contact with the culture medium, like a floor in this case. The cells floating in solution do not divide. This is anchorage dependence. They will continue dividing until they are surrounded by neighboring cells, and then they will stop. This is density dependence. If we remove a patch of cells, the adjacent cells will divide to occupy the void and then stop dividing again. However, in cancerous cell lines, they may disregard both density and anchorage dependence. Cancer in all forms is the second leading cause of death in the United States, after heart disease in all of its forms. Cancer is not a monolithic disease. It isn't just one thing. Cancer, in the broadest definition, is just unchecked cell division. Cells divide without exogenous growth factors. They may produce their own growth factors, and they may start exporting those growth factors to other cells. While cancer is a leading cause of death, it is relatively rare in the sense that most cell division occurs flawlessly. Even in cancer patients, the process of loss of cell division starts out being restricted to a few areas of the body. Normal cells may become cancerous via a process known as transformation. Our immune system can target most of these transformed cells, but sometimes that measure fails, and masses of abnormal cells called tumors may form. A benign tumor is one that is restricted to a small area and doesn't spread. Unfortunately, there are malignant tumors that can spread to adjacent tissues and to similar tissue types around the body. This process, the spreading of cancerous cells, is called metastasis. The three prongs of modern cancer treatment are surgery to remove malignant tumors, radiation therapy to damage the DNA in tumors and try and stop them from growing, and the use of chemicals or drugs, also known as chemotherapy. When I was younger, I didn't understand why breast cancer was such a dangerous diagnosis to receive. Female breast tissue, for all of its merits, was not like a lung or a brain or a heart that one couldn't live without. What I didn't understand is how breast cancer is sneaky. A person may have a tumor and not know about it. This is why regular cancer screenings, like mammograms, are important as women age. Also, while breast tissue is not as essential as a kidney or an intestine, the breasts are very highly vasculated by blood vessels and lymph vessels. These systems move materials all throughout the body very quickly, and as a result, breast cancers can become metastatic and spread to those more vital areas of the body. Cancers are still a terrible scourge, though research into the causes of cancer and therapies to treat cancers have progressed much in the past few decades. This is still a very active arena of research, and perhaps you will help alleviate the suffering of those affected by cancer in your career. Here, once again, are learning objectives. Part 2. And in the next chapter, we will talk about sex, but not in the way that you're thinking, the boring way.